you, Mike, and good afternoon, everyone. Unfortunately, our numbers continue to be concerning. Today, Minnesota is reporting an additional 2,674 new cases and 32 additional deaths. This brings our totals over the course of the pandemic to 732,001 cases and 8,275 deaths. All of Minnesota's 87 counties are listed by the CDC as having high rates of transmission. Transmission in schools and among children continues to be a particular area of concern. We're now seeing more than 3,000 cases a week in children under 12. This represents a new and troubling high mark for the entire pandemic and highlights the important point that COVID isn't just a concern for older adults with underlying medical conditions. This disease can and does impact young and healthy people, including children. It's true, and we're grateful for the fact that children are generally less likely to have severe illness, but there are sometimes tragic exceptions to that rule. Today's report includes 514 new cases in K-12 schools around the state, including 441 new cases in students and 73 new cases in school staff. There are currently 996 schools with cases, and 158 of those schools have 5 or more cases. Currently, there are 881 COVID patients hospitalized, including 234 in the ICU. The latest data also include 21 pediatric beds being used for COVID-19. We've said many a time that vaccination is our most powerful protection measure, and we're happy to report that today's figures show that another 1,322 people got their first vaccine dose. 1,653 completed their vaccination series. We now have 73.7% of Minnesotans over the age of 16 and up, who have received at least one dose. And as we've said many a time again, every vaccination makes us more resilient, not only individually, but also as a community. And every vaccination helps reduce the pressure on our healthcare systems and our healthcare workers, be that in the acute care system or the long-term care system. We do continue to have concerns about the impact of this Delta variant wave on our hospitals and healthcare systems and long-term care, both in terms of the capacity of the systems and the human impact on healthcare workers. I'm very grateful today to be joined by 3 leaders from Minnesota's healthcare sector. In a moment, we will hear from each of them about what they're seeing and what they want Minnesotans to know. We've been saying since the beginning of this pandemic that it's a top priority to protect the capacity of our healthcare systems to make sure that people are getting the care they need. And that means people with COVID and people with every other important medical condition. COVID cases are going up, and they've been going up steadily for quite some time now. And along with the case increases, we see increases in hospitalizations. As I mentioned earlier, there are almost 900 COVID patients hospitalized at the present time, including 234 in ICU beds. And we're now actually seeing hospitalizations in greater Minnesota on a population basis exceed those in the metro area. Current levels of hospitalization and ICU use are now above the level that we saw in the spring 21 surge. And we have just 1% of hospital beds available in the metro region, 5% in the southeast region, and 7% in the central region. Across the state, we have more hospitals reporting that they have 0 available adult medical surgical beds and 0 adult ICU beds available during this latest surge. And these are numbers we didn't see even in the worst of last year's fall surge. Capacity is tight everywhere, including for pediatric hospital beds, and perhaps particularly tight for pediatric hospital beds, since that is a resource that is thankfully smaller numbers of available beds at any time, just given that severe pediatric conditions are more rare. However, the current capacity crisis is really quite extraordinary for pediatric capacity. The latest data show that there are no pediatric hospital beds available in the central Minnesota region, only 2 available in the southeast, 1 bed each in the northwest and south central region, and only 7 available beds in the metro region. There are no available pediatric ICU beds in the southeast region, and only 7 beds available in the metro area. Even before COVID cases started to rise in this latest surge, our hospitals were very full with patients needing care for other critical conditions. And this highlights the fact that as more beds fill with COVID patients, there are fewer beds to allocate for any condition, COVID or otherwise. And what's important to understand is that this isn't so much about the physical asset of a hospital bed or a ventilator, and those were big focuses earlier in the pandemic. But now this is really an issue of healthcare worker capacity. And there are actually fewer healthcare workers on the job today than there were last year due to the extreme stress and burnout that they have faced for over 18 months now. Despite the extraordinary collaborations happening across the whole healthcare system, it's getting harder for some hospitals to find open staffed beds at the right level of care for critically ill patients, whether that's due to heart attack, stroke, or COVID. This is an issue statewide, impacting both small rural facilities and larger metro systems. We at MDH are closely monitoring the situation and are in very regular daily contact with our healthcare leaders about the steps that they're taking, and they are working very hard to manage capacity, and also talking with them about what measures we as a community and a state can take to support them. The administration continues to use tools that we have available to help. And as you may recall, earlier this week, Governor Walz sent a letter to legislators about actions that are needed now to help protect hospital and healthcare capacity. Some of those measures included temporarily reinstating bed moratorium waivers for hospitals, giving nursing home facilities some regulatory flexibility related to bed requirements, allowing for nursing home transfer and discharges by waiving some notification timeframes and the like. Some of these are very technical measures, but they are important to helping the systems use the capacity that they have. We need the legislature to work with us to address these issues, but frankly, that's not all. We need all Minnesotans to do their part too. The best thing we all can do to help preserve this critical hospital and healthcare capacity is to reduce the amount of disease transmission that is happening in our communities, including and especially in our greater Minnesota communities and in our schools, where we still have many children under 12 who are not yet protected and can't be protected yet from vaccines that make such a big difference. All of us as Minnesotans need to do our part to limit transmission of this virus and to protect ourselves, but also our neighbors from the harms the virus can cause. That means getting vaccinated when you're eligible, getting a booster when it's recommended, wearing a mask when going to public indoor settings, staying home when you're sick or exposed to someone who is sick, and getting tested as appropriate. It means taking COVID seriously, despite our fatigue, recognizing that the pandemic is not over yet, and that our daily choices and actions directly impact the course of this pandemic in your own family, your community, and your state. Please help us, and please help our hardworking healthcare workers to reduce the pressure on them in any way we can. With that, I'm grateful to have with us Dr. Croston, who not only is the CEO of North Memorial, but he is a practicing surgeon as well. Thanks, Dr. Croston, for joining us.
Thank you, Commissioner. As Commissioner Malcolm suggested, I'm the CEO at North Memorial Health, where our nearly 7,000 team members operate and provide care across 2 hospitals, 26 clinics, and we also provide air and ground ambulance services across most of Minnesota and western Wisconsin. So I want to thank you for having me here today to talk with you. It's been a pretty challenging year. In fact, I think it's probably the most challenging year I've experienced in my 30-plus years in healthcare. And I would just reiterate some of the things the Commissioner always said. Every element of our health system is incredibly stressed, and it has been for a long time, and it just keeps building. We're once again experiencing significant increases, as Commissioner Malcolm outlined, in the number of emergency visits and in the inpatient care due to COVID-19 and the highly contagious Delta variant. And both of our hospitals have full ICUs and full medical surgical units. Our current hospital experience reveals that 100% of our patients who are COVID positive in our ICUs are unvaccinated. And of the COVID positive patients in our medical surgical units, 75% are unvaccinated. So there's a clear distinction here. This surge, however, is overwhelming everyone, including the transitional care units and senior campuses, which are also at full capacity. And the problem with that is that it causes a significant backup because of hospitals' inability to transition customers from the hospital into these units, TCUs, or long-term care facilities. That sometimes we have patients staying in the hospital for 3 weeks that could be discharged because there's just no room. While all this is bad, a good outcome from all of this, however, is the fact that Minnesota hospitals and health systems are working together to meet this challenge and coordinate care. Hospitals in the Twin Cities coordinate with hospitals in Greater Minnesota and vice versa, and our teams communicate daily to support each other and the joint mission of serving all Minnesotans. I tell you, it's been humbling to see the level of partnership I see every day between the care teams and the leaders from all the hospitals and health systems across the state. And you should feel good that we're all working together to create this system of care. And I really think this is something of which we should be proud. I also want Minnesotans to know that we're pulling every single lever we can to preserve an excellent quality of care for you when you need us. We're doing everything we can to keep some capacity. This includes postponing surgeries and procedures to increase care capacity in hospitals, and this is being done across the state. As a surgeon, I understand the effect these delays can have on our patients, and that delayed care can have an ongoing effect on their health now and into the future. However, and just know also that our clinicians take this responsibility very seriously, and we're working hard to provide care to each patient that needs us. So in my terms, North Memorial Health and the healthcare teams across our state are dedicated to working together every day to continue to meet the needs of our community. But the reality is that the staff are exhausted, and they're working harder than they ever have. We have staffing shortages that were mentioned earlier that continue to be a very big challenge and have actually reached a critical level. Staff vacancies are increasing while our patient volumes remain high, and we have rapidly escalating measures to attract and retain talent in healthcare, and that's adding more expense to an already stressed financial picture for all these healthcare systems. Coupled with the fact that competition with staffing agencies is significantly impacting our ability to retain and recruit staff, creates a double whammy. So North Memorial Health is here for our community despite these challenges, but we continue to echo the commissioner and ask our communities to take action. You can help by paying attention. We know we're all tired of this virus and this pandemic, but the single biggest thing you can do to help mitigate some of this is get vaccinated and get a booster when it's your turn. Continue to wear a mask, practice hand hygiene, and remain socially distant when possible, and don't forget this. And the surge of the COVID-19 cases is and continues to be avoidable if we do these things. So we're asking all Minnesotans to help us work to the goal of ensure that our communities are healthy, and we do appreciate their partnership to date. And I want to thank everyone for the opportunity to share a few thoughts. Next, I'm going to turn it over to Rochelle Schultz.
Thank you, Dr. Crossan. Good afternoon. I'm Rochelle Schultz, and I serve as the President and CEO of Winona Health, located in southeast Minnesota. We have more than 1,000 employees that are serving our patients in the Winona and the surrounding area. And as the Commissioner indicated, there's a lot of implications here for Greater Minnesota hospitals. Rural hospitals are starting to feel that pressure, as has been described by Dr. Crossan and the Commissioner. Greater Minnesota hospitals and health systems like mine are undergoing the same stresses that we're hearing about in the metro. And all hospitals across Minnesota are working very closely together to meet the needs of all Minnesotans. We have a very unique structure in this state, and it's one I'm really proud to be a part of. Hospitals in my area work very closely together, and we communicate regularly regarding our patient needs and our respective resources, whether that be people resources, beds, equipment, and so forth. Additionally, we coordinate with hospitals from across the entire state of Minnesota, both in the rural areas as well as metro. And by way of example, while my primary focus in our community is our service area and the patients that we serve, we do and have taken care of inpatients from the metro area as well as greater Minnesota to help out with this patient demand that is really taxing hospitals across the state. And our ability to connect and coordinate care across the state is, I think, very unique to Minnesota and really a stellar way of how we work together and how we must continue to work together to deal with all of the issues that are being brought forward. Further, within our community, we work very closely with other organizations such as public health in our area schools, both K-12 and higher education. And we do this in partnership to really mitigate the spread, which is what is taxing all of our systems. And we need our communities to continue this effort alongside of us. As has been said, and I don't think we can underscore this enough, our healthcare workforce are true heroes, and they have been running this race for more than 18 months. They're a compassionate group of professionals who find themselves at the epicenter of healthcare history. And this can be both fulfilling, but it is also exhausting. Staffing is very tight. The staff are working to the highest levels and the best of their abilities, but we could use more people, and they're not out there for us to get. So we need to protect our staff while we're also protecting our community with the situation with COVID. Our core mission is to care for Minnesotans when they need us, and those needs can change, as is evidenced by the impact and the ongoing presence of the pandemic and how it is wearing down lots of our systems. But this is what we're here to do, and we're not going to stop doing that. And that's true for every hospital and healthcare system in the state. As with the other pleas that were made here, there's a couple of things that are important asks for everybody in Minnesota. First, when you come for care, please remember the incredible stress that our healthcare staff are under, and treat them as who they are, your friends and neighbors. Also, get vaccinated. That is like one of our biggest tools out there, as well as masking and all of the other infection prevention interventions that people can take. And I do want to make a shout out even for flu shots. We just started our flu shot clinics this week along with COVID boosters and the COVID series for people not yet vaccinated. And I think if we look at the impact of how we were able to mitigate even influenza in our communities through masking, through vaccination, we basically saw it disappear last year. We could do the same with COVID if we took it seriously and pursued vaccination, masking, and other infection prevention. So we are here to help, and we need the help of our communities and each other in order to get through this together. With that, I want to thank you for your time this afternoon, and I would like to turn this over to our next speaker, Dr. Mark Corliss.
Thank you, Rochelle, and thank you, Commissioner Malcolm, for the opportunity to speak today. As you have heard, the entire healthcare system in Minnesota is under a tremendous strain. And while it is true that COVID-19 disproportionately affects adults, children are by no means spared. And we at Children's Minnesota are experiencing many of the same issues of volatile and surging volumes, staffing shortages, and provider stress as our adult system counterparts. As the largest provider of pediatric care in the state, and as the kid experts, Children's Minnesota has a duty to respond so that kids and families who rely on us can get the care they need. And we partner with the state and with the other health systems on any issues that affect the health of kids in our community, including the response to COVID. In the past few months, we have seen dramatic increases in visits to all parts of our healthcare system. There has been an unexpected and truly unprecedented summertime surge of a typical winter respiratory virus known as RSV. That has come then along with the usual and expected seasonal increases in asthma and injuries, a really heartbreaking rise in acute mental health issues, and of course, a bump in COVID-19 cases. And all of this has led to record hospital occupancy, a near doubling of ER visits since early spring, and a 17% increase in the last month alone, and hundreds of additional children seeking care in our outpatient clinics and our urgent cares each day. At the same time, the healthcare system throughout the state, and indeed the nation, is struggling with a shortage of staff in virtually every discipline. This is putting a significant strain on our system, and it's one that we are working tirelessly to address. Internally, we have implemented a situation response team that meets multiple times a day to review staffing and admissions and discharges. Bed availability fluctuates hour by hour, and we're poised to respond rapidly to maximize availability of care, especially in areas like our ICU. Among the levers we're pulling are we're hiring additional staff, we're offering incentives to our existing staff to work additional hours, we're seeking temporary help from staffing agencies. We've also created fast-track treatment areas. We're directing patients to alternate locations for things like COVID testing. We triage our admissions and our procedures according to our capacity to handle them. And then externally, we're partnering with the other health systems to balance the supply and demand of pediatric beds across the state. So we're doing everything we can, and the good news is it is working. The system is strained, but we're meeting the needs of the kids in the state. And I have to say, I could not be prouder of the way that everyone here has stepped up on behalf of kids. But it comes at a cost. Our staff are stressed. The nearly 5,000 people at Children's Minnesota who come to work every day putting kids first, they are stressed. Whether it's the people on the front line of care, our nurses, our doctors, various technical staff and others, or all those other people who are needed to keep a complex health system running, they're tired, they're anxious, and they're worried about their patients and their ability to provide the exceptional care those kids deserve. And they need help. And this staffing crunch is going to last a while. So additional flexibility from the state that will facilitate our ability to increase staffing would be extremely helpful. And while for all of us, COVID is not the primary cause of the current situation, it is the thing that could put us over the top. And so we need everyone to do what we know will keep COVID under control. Everyone who's eligible should get vaccinated. Everyone should wear a mask when it's recommended. I'm asking Minnesotans to do what they can to help us keep the kids in our community healthy and safe. Thank you for the opportunity to share that, and I will turn it back over to Mike.
Okay.
Thank you, Dr. Gorelick. Yep, sorry about that. We are ready to
Okay.
take questions, operator.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the pound or hash key. Please stand by while we compile the Q&A roster. Our first question is from Glenn Howitt with Star Tribune. Your line is open.
Thank you. I wanted to ask the hospital leaders, can you talk more about any care that is being deferred right now, and how does that compare to the early days of the pandemic when there was a moratorium on so-called elective procedures?
Well, this is Kevin Cross, and I'll start and have the others follow if they so choose. The moratorium that we did in April of it feels like 100 years ago, 2020, sort of shut the hospitals down, and we had, it was when the virus was ramping up. I would tell you that what ended up happening as a consequence of that is some of what we're seeing right now. People delayed surgeries and delayed care, and that just delayed the inevitable where they all arrive at the same time. Currently, when we're able to flex up and down and do the cases we can do when we can do them, when we have a little downturn in the inpatient status, we're able to proceed and get things covered for the most part. It's tight. It's inconvenient if you're somebody that's scheduled for a procedure that you need, but if we can do it in a week, most people have been really good about that. Acute care issues like heart attacks, emergency stent placements, other medical emergencies are being cared for appropriately, and is a part of the problem with the staff, with the fullness of the hospital right now, is there's a lot of acute medical emergencies, medical and surgical emergencies in the state right now. And I think all these things are related. So I would say that I think we're doing as well or better than we did a year ago because we've learned how to work with the virus better, and we've learned how to be pretty flexible with our staffing needs to the extent that we can be. I don't know, Mark or Rochelle, do you want to add?
I guess what I would add is I think, last year we didn't have a lot of information about the virus and treatment and expected surges earlier and all of those kinds of things, but we've certainly learned a lot over the course of time. And I think we're all, monitoring this. I think Mark might have indicated this earlier, very timely. I mean, things can change in a matter of hours and days. And so I think, we are all watching this very closely, and you have to triage, you have to prioritize. And so clearly, the very critical, patients are absolutely being taken care of, and we do everything that we can, to make sure that, nobody is, harmed in any of this, this process or delays or things like that in care. And again, I think that is really what is essential in the communication that happens amongst all of the hospitals across the state to ensure that patients get to where they need to be and are taken care of as they need to be.
Yeah, and I think what I would add is you remember that last April, in addition to this being a new disease and really not understanding appropriate measures for prevention, not having vaccines, et cetera, the other thing is we were facing an acute shortage of personal protective equipment. And so a lot of the moratorium on surgical and other procedures was designed to preserve that supply. And so it was a rather blunt tool because we used that supply for many things. In the current situation where we have staffing issues, we can be a lot more precise about it because it is not a global supply that we're trying to protect like masks and gowns. And so we on a regular basis monitor what we can and can't accommodate, obviously trying our hardest to accommodate everything we can because, frankly, even a non-emergency procedure when it's in a kid is often still fairly time sensitive. And, again, as the kid experts, we're able to apply appropriate criteria for when something is potentially deferrable for kids. But we haven't needed that same, global approach that we did last year where it was a much more acute shortage of a global supply.
Ian, a bit of speculation here, but is part of the surge you're seeing, especially in ER, the results of delayed care that happened over the course of the pandemic?
This is Commissioner Malcolm. I'll start and certainly welcome any of you to add on. I think as has been mentioned, definitely we have seen disruptions in patterns of care from the delayed care, from people just not coming in to seek care, and we absolutely want people to keep seeking the care they need. That is one of the big differences between the blunt instrument, as Dr. Gorelick referred to it, and where we are now. We need to protect healthcare capacity for everyone and for all kinds of care. So some of the current volumes are from just chronic conditions, perhaps not having been as well managed during the pandemic, because of people not seeking the care for a lot of reasons. It was a very busy trauma season. And as Dr. Gorelick mentioned, this really, unusual and dramatic rise in other types of illness among kids is certainly also contributing. But anybody else? What would you say about your patient mix these days?
Yeah, I would tell you, this is Kevin Crossan again. I would tell you that, interestingly enough, the acuity and the severity of the illness that we're seeing has amped up significantly from this same time last year. Has to be, I can't tell you exactly why that is. I think the commissioner's right. There's a delay has caused some of that process. But the people that are by and large in the hospital are much sicker than we've seen historically all at one time. So I think something certainly in this community has changed, and the logical thing to look at is the virus and how it's changed behaviors. I would also state that, North Memorial is a level 1 trauma center, and the trauma volumes that we've seen have escalated dramatically. All the way across, we had our busiest July we've ever had in our history, and every month seems like it breaks another record. And so to that point, the term elective surgery is kind of a misnomer anymore because that isn't really done in hospitals. Elective is just scheduled surgery that has to be done sometime. And so I think one of the things that we've said a couple times now, but we've learned how to work with this a little better. We know when to delay and defer so that we have beds to take care of the acute needs that are coming in. But it's not unusual for us to discharge 100 patients in a day and fill up on the same day. And so we've really gotten good to move. And a part of that is, again, the ability to use the TCUs and the senior care campuses to offload the hospitals. And now they're starting to fill up, and there's process problems with that. So we're working on all of that together, and I anticipate that right now we're doing okay. And unless something changes dramatically, I think we'll manage our way through it.
And I think in greater Minnesota, you know, a lot of what we saw last year was people were very fearful of coming in. Never mind that, you know, we had to also sort of shut down certain services for a period of time and then, you know, open them back up. But I think, you know, there was a lot of fear around COVID. There was a lot of fear around coming in, you know, to a healthcare setting that they might catch that or things like that. And I think, you know, a lot of things were delayed. And of course, we, you know, have a lot of, you know, folks that have those chronic conditions that really do need ongoing management to keep people well and out of the hospital and so forth. So we are getting, you know, that effect after, you know, not coming in for, you know, some period of time and, you know, and taking care of it. And that just, you know, sort of bogs down the system a little bit because we got behind, I think, on some of that work. And that was as much from the patient perspective of coming in as it was, you know, our ability to get to them.
Thank you all.
Next question, we have Theo Keith with Fox 9. Your line is open.
Hi, question for the commissioner. As you know, positivity rate has shot up in the last really 10 days or so. You've got lag period data that's not public. We can't see it. So I'm wondering, is this the start of a Missouri, Louisiana style surge or simply a blip?
Well, Theo, I sure wish I knew. You know, this wave has been different than prior waves in that we have not seen the sharp spike up, that kind of exponential growth rate that we saw in some of the other surges, but it's been this steady, inexorable increase over a long period of time that is different about this wave. And so what happens from here? You know, I think we know that it's not going to be the same pattern as we've seen before because it's already different. But yes, positivity is up, and the double concern with that is positivity is up at the same time testing volumes are up. So it's not just because we're testing more. It's the percentage of the tests that are positive that's the concern. So I think it's a good question. We hope, and some of the signals that we see, and that some of the hospitals do some modeling of capacity needs, national models, you know, don't seem to suggest, that we're on the verge of that tipping point, that escalation into exponential growth, but we can't rule it out either. I mean, this has been an unusual, long, steady build in the cases. Whether that means we're just going to keep going the same way or whether we will have a more exponential spike, or whether we level off sometime soon, certainly that's what we all hope for, but with the amount of virus that's out there and the amount of the population that is not protected by vaccine, there's unfortunately plenty of room for the virus to still do its harm.
Okay, thank you.
Next question, we have Bill Werner with Minnesota News Network. Your line is open.
Yeah, thank you. Commissioner, I think this one is probably for you. You outlined some pretty serious problems in terms of infection rates in schools. You outlined, and correct me if I'm being overly dramatic, but a potential fairly serious situation with pediatric hospital beds and ICU beds in particular. You have about, most recent numbers I got from your staff was about 66%, only about two-thirds of Minnesota school districts and various other schools have accepted the federal money for testing programs. You've got a situation where Republicans in the legislature don't seem to be willing to go along with the governor's request for masking requirements for staff and teachers in schools. So, in that particular context, unless I'm misunderstanding something, the only way you can really get those kind of measures in place, masking as an example in school situation, to try to get a handle on this, is through executive order, specifically as a result of a declaration of a peacetime emergency. Am I correct on that? And if I am, how close are we to your department recommending to the governor that he go that route?
Well, thanks, Bill. I think as the governor has said and been quite clear about, our priority at this point is working with the legislature. They had expressed strong desire and need to be involved in the decision making, and that's where we are right now, is making suggestions to the legislature. I know that various stakeholder groups are also communicating with the legislature about the need for action. So that's where our focus is right now. Is we want to work in partnership with the legislature. So I'm not giving up on that route at this point in time.
Commissioner, if I may, I know, and I don't think I'm presuming anything, that your number one priority is the public health of Minnesotans. I have to conclude then that if you're still wanting to work with the legislature on this, that this situation is not serious enough yet that you need to take action to get a handle on it through executive order, a peacetime emergency. Would that be reasonable?
Well, I appreciate you asking, because I certainly don't want to suggest that means that we think this is less urgent. We do think that there's an urgent need for action. The governor has talked about kind of the limitations on the effectiveness of the peacetime emergency route, and the legislature has expressed a desire to be more in the decision-making partnership with the governor, and so this is not in any way saying this is not urgent. I think I can't forecast what the legislature will or won't do, but I think our focus right now is trying to work with them and get them the information that they need to to see why these recommendations are being made.
Thank you, Commissioner.
Next question is from Peter Cox with Minnesota Public Radio. Your line is open.
Thank you. Kind of following up on Bill's question, I'm curious, especially as we've seen cases go up in the 10 to 19 age group, where we are with testing in schools, if schools have access to rapid testing, and how parents and students will know about that.
Well, thanks, Peter. Yesterday, the governor, Commissioner Mueller, and I, and the lieutenant governor were, as you probably know, visiting Carver Elementary School, precisely to see sort of a positive example of how a robust kind of multi-layered prevention plan, including a robust testing plan, can help schools protect in-person learning and protect the health and safety of students and staff. We have put in place, Commissioner Mueller has talked a lot about this, a number of different things. There are resources in the vein of free testing kits and testing supplies that we can make available to schools. There is a grant program that schools can apply for to add staff, to just help with the infrastructure of administering these things. Commissioner Mueller has said that the interest in tapping into those resources and that grant program is growing day to day. So we're encouraged that we'll do everything we can to really reach out to schools to make sure they know what is available to them and to encourage them to use it. I think MDE is putting on its website links to, and is already publishing, I think, which districts have signed up for the testing program and have applied for grants. And if they're not listed on the MDE website, then they haven't availed themselves of those resources yet. But again, that it has been growing. We expect it will keep growing. So, I think just all of this conversation just helps to underscore the time urgency of doing everything we can right now, certainly to protect the kids and to protect in-person learning, but also focusing on the very real capacity crunch that the health system is under.
Thank you.
Operator, we have time for one more question.
Yes, sir. Our last question is from Steve Karnowski with Associated Press. Your line is open.
Yeah, hi, this is probably for the commissioner. Just you folks have been talking of flu shots now as we're moving into the traditional fall season, but is it advisable that if people are going to be getting COVID shots or boosters in the coming days or weeks here, is it advisable to get flu shots at the same time, or should you spread them out?
Well, I think Chris Erzman is still on the line, and I would like her to chime in here too. This is an area of her expertise. But CDC has recently clarified that co-administration of the COVID vaccine with the flu vaccine is fine, and it's going to be a convenient way for a lot of people to get both done. But Chris, if you are still on the line, you want to chime in?
Sure, Commissioner. Yes, it is just fine to receive an influenza vaccine and a COVID vaccine. You certainly, if it works out and you are able to go to a clinic that's offering both, it's fine to get them at the same time. Or if you happen to have gotten, say, a flu shot at the pharmacy because you were there, and now it's time for you to get your booster, there's no need to have any sort of interval between receiving those doses. So you can get them at the same time, or you can get them in any order. There's no problem with that. So it's great because they're both very important, as you've heard today. Over.
All right, that is all the time we have for today's call. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we'll talk with you again soon.